the previous videos, we have seen what are the causes for male and female infertility, and more importantly, we discussed how do a couple approach a problem of fertility. So, what is the difference between fertility and infertility? Infertility is a problem where the couple is not able to conceive despite trying adequately. Let us say they tried for 1 full year, or they have been trying for 2-3 years after marriage. If the couple is not able to conceive, that is called infertility. Whereas fertility is a thing where the couple is planning to have a pregnancy and they come for something called a preconceptional check, or they want to know that everything is fine. So the basic difference between infertility and fertility is, in infertility we are already assessing a couple who has tried for a long time, whereas in fertility it is either before the start of planning of pregnancy, or the couple comes at 3 months, 6 months or 9 months thinking that they have tried adequately and they have not yet conceived. So when a couple tries to conceive, we have in the last video seen what is a fertile period, when do they mate, and what decides what is the fertile period, etc. In this video we are going to see what is the basic sperm count which is responsible for planning having a pregnancy, and also what on the wife's side is very important. On the man's side, the most important parameter is the semen analysis, and in the semen analysis the most important parameters are the sperm count and the sperm motility. Most of the couples, when they come to our OPD with a semen analysis report, they tell that the morphology is very low. Is it normal? Instead, they also tell there are a lot of sperms with defects. Is it really possible for me to conceive? Is this a normal report? Is it a big problem? Can there be genetic problems in my family or the children? So these are so many doubts which come into the mind of the couple. So in this particular video, we are going to mainly concentrate on semen analysis. So whenever a couple undergoes fertility evaluation, the first test done for the male is of course a clinical examination and history. Following that, we do a semen analysis. So semen analysis is a test where the sperm is processed and examined under the microscope. So under the microscope, we see 3 important parameters. One is sperm count, second is motility, and 3 is morphology. So these are the 3 important factors which are important in the evaluation. But when the couple is young, when the duration of married life is say 1 or 2 years, and if the couple has been trying only for 1 year, then we mainly focus on count and motility rather than morphology. Even if the morphology according to the WHO 6th classification is 0%, immediately we don't give lot of significance to it, even though in the back of our mind we will be thinking about the 0% normal. So let us forget about the 0% normal forms right now. Let us focus on a normal report, that is a normal male, normal female in the less than 30 years age group. Example, they come with a semen analysis report where the report says teratospermia. Teratospermia means the number of normal sperms is less than 4%. Next thing we have to understand is what is the normal count, normal motility, and normal morphology. So the normal count is, according to the latest WHO classification, which is 6th edition, is 16 million per ml. And the second thing, motility, a progressive motility of more than 30%, and morphology of more than or equal to 4% is considered as a normal semen report. Whenever the count is less than 16 million, it is called low sperm count. Whenever the motility is less than 30% progressive motility, then we call it a reduced motility, or also called as asthenospermia. And the third factor is whenever the morphology is less than 4%, then it is called as teratospermia or abnormal morphology. So what is the reason why these standards have been set? Because whenever we interpret a semen analysis, there are a lot of variables. Semen analysis can be differently interpreted for the same patient by the same person in the same lab. So whenever we see semen analysis, it is like an average. So we see at least 2 or 3 semen analysis before really concluding that the male has a problem. Similarly, even if the semen analysis is abnormal, then also it is possible that they can conceive naturally, because if the count and the motility are really good, then the number of normal forms doesn't matter. So whenever a couple comes with a report of, say, there is an abnormal morphology or a low count, then what we do is we assess the other factors. We see what is the male partner's age, what is the female partner's age, is the female partner evaluation all good. So whether her egg count is okay, whether her weight is okay, whether she is able to have regular cycles, and whether the tube which is carrying the eggs are okay or not. So whenever we see all these factors are good, when the husband is normal, otherwise when the wife is okay, then we go into the lifestyle of the couple. Ideally at this point we do a clinical examination and make out that everything is okay. If everything is okay, then we follow this pathway. So in this pathway what we do is we assess whether the male's weight, height is okay, whether his diet and lifestyle is okay, and we has any habits. Example, smoking and tobacco. So these are the most important things. Whenever smoking and tobacco are involved, that means that cutting down smoking and reducing the tobacco intake can really improve the sperm parameters. Similarly, whenever a man is obese, that can also affect the sperm count. And also when there is a lot of stress, it can be physical, emotional, psychological stress. Whenever there is stress, that also affects sperm count. Many people may think, how does the emotional stress affect sperm count? Yes, emotional stress is linked to hormones. It is linked to obesity and inflammation, and therefore it can affect the sperm parameters. More so, it can affect the motility and the morphology. A count is affected only when the testis is small or there is a hormonal issue. Again, hormonal issue can be in the testosterone or in the brain or in the periphery. So whenever a man has a reduced testosterone, or whenever the man has something in the brain which can be a reduced source of stimulation to the testis, then these things can happen. For this we have to understand what is the hormonal axis in the body which drives sperm production. So the most important hormones which are checked in a male include LH, FSH, testosterone, and in some patients we also do estradiol. So what do these hormones signify? Why are these hormones done? So in a male, a sperm production is governed by, or it is guided by, the hormones from the brain. What is the role of the brain? The brain identifies how is the sperm count, what is the sperm which is coming out of the testis, and there are some things from the testis which go and tell the brain that your sperm production is low. So whenever the sperm production is normal, the brain senses it and sends enough hormone from the brain. So that is to maintain the sperm count. Whenever the testis is not working, so whenever somebody is not working, what do? We try and stimulate them more. So like that, the brain also sends more signals to the testis. That is when the hormones from the brain are elevated, and because of that the sperm production can be less, and that also means that the testis is at defect. So now whenever we see a male patient, we want to identify whether the problem is in the brain or in the testis. Some problem in the brain is usually correctable, while in the testis there are only some problems which can be corrected. So whenever it comes to a increased level of hormones, say the LH and the FSH which comes from the brain, if they are increased, it means that probably the testis is at fault. Why can the testis be at fault? The testis can be at fault because of multiple reasons. Inherently, the male can have a smaller testis, or this can be in some cases genetic. There can be something around the testis which is a varicocele. In obese men also there is a problem which causes lot of heat around the testis, again making the test to function less efficiently. And also when there is exposure to chemicals, radiations, insecticides, etc., then also the testis can be at fault. So these are the most important factors why there is a testicular problem and how the brain reacts to it. So when the brain has tried enough, the sperm count is not good, the hormones start increasing, and that is where we identify that this problem is only this much amount correctable, and we may have to go for quicker other treatment options. So whenever we see the male, we see the sperm parameters where I have not yet talked about morphology. I have told that the count is low, and this can be the possible reasons. Coming to motility, whenever the motility is low, there are some important reasons where they can be as simple as the couple is not having sex regularly, or the ejaculation frequency is so low that semen gets stored for a long time and motility reduces. This is an important cause. Again, I told about smoking and tobacco. They also can affect motility. Obesity can affect motility. Varicocele can affect, and also the heat around the testis in obese males also can affect. So whenever there is a male who comes with a reduced motility, we try and see if we can correct them. So correction includes diet, lifestyle change, medicines, etc. However, motility is usually a good thing which can be modified. there are very few circumstances where the motility comes to less than 10%, which is again some patients it can be genetic. So again, when we see a male, we identify how bad is the sperm report and how bad are the hormones, and based on that we give the treatment. So whenever a male walks into our OPD or a couple come to our OPD with lot of confusion in the mind, we try to tell them the real facts but in a good way, so that they understand the problem and also they understand the gravity of the situation. So whenever a couple comes normally for a fertility or a conceptional check, things are different. But when especially a young couple comes with infertility and the sperm problems are there, then we deal it in a more aggressive way, because the earlier the treatment, the better are the results, and we can reduce the chances of deterioration of the sperm parameters. Regarding morphology, as I was also mentioning earlier, it depends upon the lab which does the test and how correctly they are able to interpret the morphology. If the morphology is interpreted the right way, and if the number is more than 2 or 3, then you can be relaxed, because in most patients, if the count and motility is good, morphology is okay. If the morphology is very low, along with the reduced count and motility, again the treatment is towards IVF. Similarly, if the morphology is 1 or 2% but the count and motility are very good, it doesn't change the management. If the count and motility are good but the morphology is 0%, then we have to really go inside, do specific tests in a special lab in an expert center by expert embryologist to see whether there is something called round sperm or globospermia, etc., where there can be a real problem in the sperm. This sperm, remember, is otherwise okay. It can move, if the count is good, everything is fine, but the sperm cannot penetrate into the egg. That is the problem. So this also can be a genetic problem, but it's a good thing, because by ICSI these patients usually conceive well. So these are the basic things a couple has to understand about low sperm parameters, the usual causes. We have not discussed about varicocele and genetics in this video. We have just dealt with superficially about the causes and how andrologist thinks in these lines to manage the male infertility. Thank you.